The sepsis improvement process team was started in 2020 due to a low pass rate in 2019 of the sepsis core measure of 38%. This core team was created with ER leadership, med-surg leadership, quality, education, and clinical informatics.
Over the course of 2020, despite everything that COVID had thrown at us, we managed to bring that up to about 56%, at which point our CEO proposed that we could get to 100%. With a goal of 100% pass rate, we pulled together a team of the key stakeholders. It was myself, the director of the hospital service, Dr. Gorsaya, nursing leadership, quality, and our education department. And we began to brainstorm how we could improve this.
This was a challenge that our team was willing to accept, but we knew it would have to be all hands on deck.
Our quality department was able to help us by breaking down all of the nuances in the step one and then providing education to the core team.
Once we all were educated on this measure, Dr. Ventura decided to make a presentation that he titled, "If You Give a Mouse a Cookie." Everyone knows that if you give a mouse a cookie, he's going to want a glass of milk.
We broke down step one into a series of logical if-then steps and then wrote that up as a presentation for nursing and medical staff at the hospital. We then had our clinical informatics folks go through and tailor our order sets so that they would default to the various antibiotics, lactate, cultures that we would need for a sepsis patient. The combination of mouse cookie logic, a checklist, staff engagement, and then real-time abstraction led to 100% sepsis pass rate during our first few months.
Once we have pinpointed that our numbers were rapidly increasing in improvement, we also realized that we were still having some fallouts here and there. We would take these fallouts as opportunities to further our education with this process. One important portion of this checklist that we realized was really needed for the staff was the handoff section. This was where we found most of our fallouts were occurring. Our EMR notifies certain people that we have designated when a code sepsis is initiated. We have chosen to do this because when they are notified in real time, they are able to abstract the chart in real time. If we are missing something or not doing something correctly in the right time frame, they can notify staff and help them get through the process appropriately.
At this point, it's October. Our last sepsis fallout was in April, and we've been 100% for Step 1 measures since May. We celebrated this in September during Sepsis Awareness Month. We had a sepsis awareness walk. The mice themselves delivered sweet treats to the staff. And then we've placed a permanent sepsis dedication wall outside of med-surg that highlights all of our sepsis successes.
This wall has statistics on sepsis and is located right outside of our med-surg department, and anytime a successful sepsis discharge is taken out of the department, they place their ribbon with the patient onto the wall. The success of the sepsis improvement process at Horizon Health is not due to one person, but due to the dedicated leadership and team of staff willing to learn and better care for their patients.